Hello, my name is Shaughnessy, and this is my podcast called Samples of Science Cuisine, and I would like to introduce today's guest.
All right, can you go ahead and introduce yourself for me?
Laura Volmer. I am a nurse by trade. And do you want me to go into professorhood too, or just nurse?
You can go a little bit into professorhood if you want to.
Okay. Well, nursing professor as well.
Okay. How long have you been a nurse for?
For 13 years now.
Wow. And have you been in the same specialty the entire time?
Yes. I actually, in nursing school, so I went to a diploma nursing school. So in my nursing school, we did 2 to 3 days of like full day clinical. And you get to go throughout different specialties, and then you get to go through different, just different areas of nursing. And I always said I hated cardiac, and I never would do it. That's the only thing I've ever done.
Yeah. What draws you specifically to cardiac?
I like organization, and I am I love policies and I love procedures. And in cardiac, there is always a protocol for something. Your patient does this, here's your protocol. Your patient's heart does that, here's your protocol. So I like the rules. Yeah. I feel like in some of the other specialties, it's, as much as I love true crime, I don't always love that I have to be a detective. I do love that aspect in some parts, but I love in cardiac, like I said, that there's always a protocol that I have for something that goes wrong. So I always have an idea somewhat. How
it's
to fix
like
it.
Predictable in a sort of sense.
Yeah. Yes.
That makes sense. Are you in like the cardiac ICU?
I've worked in the cardiac ICU. I've done cardiac, cardiovascular ICU, cardiothoracic ICU. I did cardiac step down. So step down is where you're not sick enough to be in an intensive care, but you're not good enough to just be like on a regular medical surgical floor. Okay. So you're kind of in that in between. Okay. So there's different ratios depending on how acute your patient is, how sick they are. So in the ICU, you're usually one nurse to one patient, one nurse to two patients. On step down, you can have 3-4 patients to one nurse. And then if you're usually in like a medical surgical, the patients are sick, not sick enough, or not, they're too sick to be at home, but not sick enough to be in a critical
like
care.
A regular floor.
It's like a regular, thing. Yeah. And then you can have anywhere from like 5 to 6 patients to one nurse in that arena. So, and then I've done like just regular telemetry. So the patients, I've had like 5 to 6 patients, but they were still on the heart monitor. Okay. So I've done a little bit of all of that. Yeah. But it's always been cardiac focused.
Yeah. So you kind of found that you fit in cardiac in nursing school?
No. Whenever I first graduated nursing school, so it's not like it is now. It was actually a little bit more difficult to find a job. Some of my nursing school friends, they didn't have a job for months. Oh, wow. Like, it was pretty competitive. You kind of had to know somebody to get a job somewhere, especially because a lot of nurses would go and they would keep these jobs until they retired, especially if you worked in like a government facility like the VA. Yeah. Those types of jobs are really hard to get into. So I got lucky and I got a job first out of nursing school in a medical surgical, and I did that for just a couple months, and then I ended up getting a job on a cardiac step down. Okay. After that, because I knew, med surg wasn't for me, but I knew that I also needed experience to get another job. So that happened really early on, and then I got that job, and I'm like, oh, I won't stay here forever, and I did. Yeah. The rest of my career, I've been there.
Yeah. So you mentioned that you went to diploma nursing school. What is there a difference between, like, describe the different nursing programs?
Absolutely. So, I went to a diploma program, so that is more like a vocational school, like a technical school. There's actually not a lot of them around. The majority of them I have found in networking, in my job as being a professor too, and knowing nurses, going to conferences and things, is that I feel like a lot of the diploma programs are East Coast based. A lot of them are actually in Western Pennsylvania, which is where I'm from. But it is like I said, a vocational tech school type of thing. I went it was 22 months at the time They've now actually pushed a lot of the diploma programs to 16 to 18 months.
Okay.
So you go to nursing school. It was really intense. You're in lecture, 2 to 3 days a week, but it's an all-day thing, like 7 to 3:30. You're in lecture, and then you have clinical. And your clinical experiences are 2 to 3 days a week, like a full 7 to 3:30 shift that you're in training in the hospital with your professor, your nursing instructor.
Mm-hmm.
And we were in clinical from like the first week of nursing school.
Oh, wow.
Yes, it was pretty intense. We were all kind of, what do we do? We have no idea what we're doing. We're just here. And then you learned as you go. It was really intense. It was fast paced. It was difficult, but I am a hands-on learner. So I knew that I needed to be in the hospital to learn. I can't sit in a classroom and listen all day. I need to have my hands on it. I need to be involved in it for me to actually put together the puzzle pieces and learn. So that's the route that I went. And whenever I graduated nursing school, I graduated with a diploma. So I didn't have a degree. I just had a nursing diploma, but I still sat and took the same, the State Board of Nursing test as everybody else did. I just didn't have a degree. Also, you could do an associate's program. So you could go for 2 years, get your associate's degree. There's not as much clinical time, so they're not in the hospital as much. They have more credits under their belt. Okay. But then again, they still sit and take the same NCLEX, it's still same state boards that you take.
Yeah.
And then there's the traditional bachelor's program, where you go for the 4 years. The first 2-ish years, or you take your undergrad classes, your prereqs, like your fine arts classes, your English, your psych, all of those types of things. And then your last 2-ish years, you actually are in nursing. Okay. And then when you graduate, you get a bachelor's, but again, you still sit for the same State Board of Nursing. Okay. And then we actually have now, is more popular, is like second degree. So students will come in and take, like they already have a bachelor's in something, so they just take all of the nursing classes and then they graduate.
Oh, okay.
So there's those types of programs now.
Okay.
And then once I graduated from there, I worked for a little bit, and then I got my bachelor's online. So there's like RN to BSN classes. So if you get your diploma or you get your associate, you can go and get your bachelor's. You don't have to do, the clinical and the nursing pieces. It's more like nursing theory, nursing science, nursing foundations, those types of things.
Okay. So from a diploma, can you go right into working as a nurse, or do you have to do the BSN first?
No, I actually started working. I worked for about a year before I finished my bachelor's. Now, I will say, whenever I first started nursing, they didn't really have the career ladder and the tiers that they do now. I know a lot of teaching hospitals do this. I don't know so much as community hospitals, but there's different steps on the career ladder. So if you go back and get your bachelor's, if you don't have it, you can get a pay raise and you go up the tier, the career ladder, for promotion. You can do different, you can do different, like unit projects and research and things like that to go up the career ladder. So it's different ways to look at, bonuses, pay increases, chance for promotion, those types of things. Okay. They didn't really have that so much whenever I first started, but now it is more prevalent. And we also have different facility statuses. So like Ruby and some of the bigger ones around, like if you go up to Pittsburgh and you're at like UPMC or you're at, Allegheny Health Network, a lot of them have magnet status, which is more so they want to focus on individuals who have degrees, that we're looking at the science, we're looking at evidence-based practice and how we look at things and who we hire. Okay. And it's more of a, I don't want to say fancy designation, but it's something that attracts nurses because there are, and other healthcare people, because there's different communities, there's a lot of professional development, there's a lot of education, mentorship, a lot of guidance, where in the community hospital, you don't really have the career ladders and the tiers and the opportunities that you might have at like a teaching hospital.
That makes sense.
Yeah.
So going back to nursing school, can you walk me through like what your day-to-day would be in that aspect? A typical day. So in a diploma program, we would go and we would be in lecture most of the day. So it would be, there's different models for nursing school. Whenever I went, it was like a medical based model. So I would go and my professors, my nursing instructors would teach us,
here's this disease process. We would talk about it. We would learn about it. Like diabetes, for example. Here's diabetes. Here's like the pathophysiology behind it. Here's what happens to the patient. And then we would learn, this is your role as the nurse. So this is how you take care of your patient. This is how you assess them, the interventions, the labs, the meds, etc. And we would learn about the different disease processes. And actually, as being a nursing instructor now as well, we do a lot more of the concept based. So like here is the concept of, endocrine. Mm-hmm. And here is like thyroid disease. Here is diabetes. Here is this. And you look at it more so as a issue rather than just look at specific disease processes. Because one of the beautiful things about nursing is you don't always see the same thing twice, because every body is different. So just because you would have diabetes and I have diabetes doesn't mean our bodies react the same way to it. So learning it as a concept is a whole different ball game than just saying, here's diabetes, here's what the body's going to do and what you do about it, because not everything's going to be the same. Yeah. So there's a little bit of a difference, but we did the medical model. So we would learn that. So we would be in class, usually 6 to 8 hours a day, several days a week, just kind of depending on where we were at in the program. And then 2 to 3 days a week, we would be in the hospital. So you go to the hospital, your professors would give you a patient assignment, and our job was to be with our professor or be with the nurse who had that patient, and we would take care of them and learn how to be a nurse. Learn the different types of assessments, interventions, how to care for them, what to do in case of an emergency, the ins and outs of what we do on a shift. Yeah. We would get there, at shift change, so we could listen to a report, and then we would stay to, at the end and give a report. And then we usually did like a post conference at the end and debriefed on the day and those types of things. But it was pretty intensive, and a diploma. I mean, any nursing program is pretty intensive. However, it's a good type of stress. I think it prepares you for the stress and the demand of the job. Okay. But yes, it was a lot of class, a lot of being in the classroom, but we also had a lot of skills, so that we had skills labs. So we would go in this skills lab, and it was, a lot of them mimic hospital rooms or clinic rooms, and we would have mannequins, or we would have people that they would hire to play like a standardized patient, and we walk through like simulation. So a lot of times it was classroom, simulation, and then go do it in the hospital, so that we had a better sense of confidence. We felt a little bit better about doing it on a real person. When we were learning how to do IVs, or we were learning how to give like an injection, or learning how to put in like a Foley catheter or things like that. We would do it on a mannequin first, and then
that makes sense.
Do it in the hospital. So
you want to try it first before you try it on somebody.
Yes.
Like a real patient.
I would rather make a mistake on a mannequin than I would on a person.
Definitely. So can you walk me through your day-to-day as a nurse, like as a practicing nurse now?
Yes. So I think nursing is a lot different in timing for the job, because there's a lot of preparation for what you do. So I know, like, my partner goes, punches in at 8:30, sits at the desk, or, answers phone calls, goes to meetings, does, accounting and those types of things. And then at the end of the day, they punch out and they go home. But that is not necessarily what we do as a nurse. Some nurses go in early and prepare, so you can prepare off the clock, which is not encouraged. You should not work if you're not getting paid. That is my theory. Yeah. But some want to prepare, because as soon as we start the day, as soon as you do punch in and you get report on that patient, you have to be ready to hit the ground running, because you need to know everything about that patient. You need to know their allergies, their age, their past medical history. You need to know their blood work, what their lab work says. You need to know what medications you're going to give if the patient's going for a procedure or a surgery. You need to know basically the ins and the outs of everything. And as the nurse, you're kind of the middleman, because we have to coordinate with all of the therapies. So all of the providers, all of the specialists, all of like respiratory therapy, physical therapy, occupational therapy. We're kind of the middleman. So we need to kind of have our hands in all the pots, so to speak. So some people do go in early, comb through the patient's chart and get all their data. On the unit that I work on, we do a safety huddle. So night shift charge nurse will give us all of the information, like, to get prepared. So like, this patient's really sick. You guys might need to focus a little bit more on that room. This is how many people are going to be discharged. We have this many patients going to surgery. We have this many patients that are a fall risk. So listen out for those bed alarms, those types of things. Any patient patients that might, again, just need an extra set of hands or an extra set of eyeballs if they're getting really sick. And then just kind of, like I said, any unit safety issues. And then we go ahead, we get reports. So the night shift nurse or the day shift nurse will give report to me, depending on what shift I'm working. We go around to each room and we talk about what's going on. We ask the patient if they have any questions, and we do we check any drips, we check any wounds, we double check that so that we're all on the same page. And then that nurse leaves when they're done giving me report. And then I get started. I usually look at my most acute patient first, so whoever's the sickest, and then I take care of that, and then I kind of go down the line again, depending on, now, if you're in the hospital setting, a lot of times you can get pulled to another unit, meaning if your unit's fully staffed and there's another unit that's short-staffed, if it's your turn, you're going to go to that unit to help out, and you're going to take a patient assignment. So, depending on where I'm at for the day. If I'm on my home base, I kind of know what I'm doing. If I'm not, if I get pulled, I've gotten pulled to oncology, neurology, med-surg, psych, floors, those types of things. So I would try to get acclimated to whatever I'm doing. But like I said, we're responsible for putting any orders that the doctor, the nurse practitioner, the PA puts in. We're responsible for carrying those out. We're responsible for delegating tasks. And in any task that I delegate, I still have to make sure it gets done and it gets done correctly. And I need to follow up with any intervention. So I'm responsible for anybody who is underneath the nurse's scope. So any patient care techs, clinical associates, depending on what they call them, nurses, aides, whatever they call them, wherever you work as a nurse. Collaborate with any of the teams. Again, any assessments, labs, meds, anything like that. And then it does get busy. You get admission. So patients, if there's an empty room and that's my room, I'll get an admission. So they might come to the emergency room. They might come up after a surgery if there's complications. They might be a direct admission, meaning the doctor saw them in the office and was like, hey, you need to go to the hospital because you need, you can't go home safely. So they'll come straight in from the doctor's office sometimes. Just depends. And then patients get well and we get to send them home, which is happy. But it can get really busy. And then I need to stay until my work is done. So say I get a patient admitted at 7 p.m. Well, I'm going to have to stay and make sure that they're safe. I have to make sure that, they're not deteriorating. I have to make sure that, another nurse and I are checking the skin together, that we're making sure the admission's complete, that the patient's safe. So sometimes you can punch out at 7:30. Sometimes you may not. And the other big thing is documentation. I feel like I am tied to the computer a lot because everything happens on the computer. So I have to make sure that all of my documentation is, so everything that I did with my patient, it doesn't matter unless I document it in the patient's chart. So sometimes, you get so busy inside of a patient's room that you can't always document everything that you need to document on. And I have to do everything, like my assessment, what I did for the patient, any interventions. I have to document on their education plan, their care plan of all of the things that I did. Make sure all the medications I gave are documented. Anything and everything that I do. Anytime I'm in that patient's room and completing rounds and just checking on them, all of that has to be in the chart. And we get audited on our charting. So say that the patient gets a pressure injury. If I didn't document on that patient that I was turning and repositioning them every 2 hours, that's on me. If the patient gets an infection while they're in the hospital and I didn't document what I did for infection prevention, that's on me. So it's really important to go back in and chart. So that's, I think, a lot of the things that happen after is nurses have to stay and document. Yeah. Unless somebody is actively coding. Yeah. And then we still stay. Yeah. And because that's the other thing, we are responsible for that patient while we're punched in. So if the other nurse is late, like weather, I still have to stay because that's my patient. I am legally obligated to stay until there is another licensed person that I give report to. And then they can take over care. And then I can punch out. Because I could actually lose my nursing license for that. Abandoning patients. Wow. Yes.
Seems like there's a lot of pressure put specifically on nurses.
There definitely is.
But it's rewarding.
It is. So I actually am working on this, and I know that this is, I guess, not so much geared as being a bedside nurse, but I'm trying to help. So I'm working on my PhD right now, and part of my research focus is improving emotional intelligence in nursing students so that we can better prepare student nurses and new grad nurses for the pressure that happens. I will say, as a brand new nurse, I kind of floundered. I was miserable. I was unhappy. I felt like a failure because there was just a lot of pressure. There was a lot that happened, and you're just so busy. Sometimes you don't get to mentally wrap your head around all of the emotions that are involved in it. As a nurse, we care for our patients holistically. So I'm not in there just doing physical things. Like, I am going to be there for you emotionally, mentally, spiritually, if that's what you need. Like, we care for them holistically. So we care for a whole person, not just bits and pieces of a person that we choose to. So it took me a while to really grasp that and be able to deal with that mentally and emotionally and process that myself, because you can see a lot of traumatic things during that, and patients can talk to you about really traumatic things. And you can, I worked in pediatrics for 3 days before I left because I just knew I could not. I mentally could not handle that. I thought I wanted to until I got there, and then I was like, this is not for me, because it is so sad. It was sad for me, to see sick babies, sick kids. But either way, I'm trying to work on how to better prepare us for emotional intelligence. It wasn't until probably about a year into nursing where I felt comfortable. I felt like I knew what I was doing. I felt like I could grasp what was going on. Like, my critical thinking skills were that's always a work in progress, but I felt like my critical thinking skills were getting to where I needed them to be. But I also was able to mentally and emotionally process what happens during a shift. And I don't ever want any new nurses or any of my nursing students to feel like it's not a rewarding career. It's not something that they love doing because they struggle emotionally with what happens. So I would love to try to help new nurses be able to process that, because it is, I cannot not imagine doing anything else. That's why I work full time as a professor, but I still work as a nurse because I love what I do. And I always tell my students this: I want you to love this job as much as I do. So however I can help guide you and support you to get there, I want to do that, because I want you to come to work and love it. I mean, I think we all grumble on the way into work because it's called work. It's not play. But I want you to be able to go in and enjoy what you do and love helping people, love caring for people, and to love loving other people enough that you're like, I'm going to do this, and I like doing this. Despite the pressure and despite the difficulties that you can encounter, however I can best guide and help you grow in that emotional intelligence to be able to handle all of this and still love what you do.
So what's a really important character trait that you relied on to get where you are today?
My stubbornness. Despite the way that I felt during nursing school, during that first year, I'll never forget. Sometimes I'd walk in a patient's room and I'm just kind of like, who let me do this? Like, I need an adult. And then I had to realize I am the adult, and I had to push forward, and I am just so stubborn, and I am very much a perfectionist. So I think despite those definitely they can be my downfall a lot, but I think my determination to succeed and my determination to do well, I think helped me get to where I am.
So kind of going back, well, you can go back as far as you want to with this question. What would you say is your biggest failure? And then on the opposite end of that, what would you say is your biggest success? And you can go back as far as nursing school, high school, however far you want to go back.
I think despite all of the things that, that was thrown at me that kind of I thought would be things to get in my way through nursing school, I had an infant in nursing school who grew into a toddler while I was in nursing school. So that was difficult. And, I had odds stacked against me as being that young and having a kid and trying to go through that. But I had a good support system. But I think the biggest thing was having that lack of emotional intelligence, having the realization after, like I said, it was probably about a year that I was only human. Mm-hmm. You know, I'm only one person with two hands. And I felt really big emotions. And I was, you know, you go through a lot of things, especially whenever not that it doesn't happen on, you know, med-surg units, but when you're working in step-down, you're working in cardiac ICU or any ICU, your patients are really sick. You're going to see a lot of really sick people. You're going to, you know, do invasive things to people. You were going to be up close and personal in people's business that you didn't know that you could do, you were going to be in. And I didn't know how to process that, like I said. So I think not recognizing that I was also human and I needed to process this and I needed to work on myself, to improve my emotional intelligence, to talk to other people, to have professional communication with other people, to be able to recognize my own bias, to be able to recognize those things within me, I think led me to being a successful nurse, to being a better nurse, to being a better person, and how to better care for people. So I think digging deep into myself and recognizing a lot of those things and recognizing that we all have unconscious bias and having to be able to check that, to realize that my tone and inflection in communicating with other people really matters. I was 19 years old. Yeah. I didn't know what I wanted to do whenever I grew up. And then whenever I figured it out, I still didn't even think I had it figured out, you know, and then just to realize that, you know, I needed to be a better human, and I am human, you know, and that is not a fault. That is a beautiful thing, and I need to embrace that, but I also need to better myself. So I think recognizing that, moving forward from that, and digging deep, going to therapy, you know, doing the things I needed to do for my own mental health, I think helped make me into, like I said, a more successful person, but a better nurse.
Yeah. So would you say that was your biggest success, was kind of becoming more emotionally intelligent?
Yes.
Okay. So kind of going back a little bit in this conversation, did you always know you wanted to be a nurse?
No, I did not. I came from a really small one-horse town, and I am a first-generation college student. Okay. So I did not realize, I mean, I knew that there was a whole big world out there, but I guess I didn't realize how much and how many options I had. Yeah. So growing up, I'm the oldest of four, you know, so 4 girls. So, you know, I was like mom junior a lot of times. And I knew that I liked helping people. I knew that I liked taking care of other people, but I also recognized that I like to talk a lot and I like to teach people things. So I was like, oh, maybe I want to be a teacher whenever I grow up. And then my grandma, who I was very close with, my dad's mom, we lived right beside each other. She got sick. She had kidney failure. And so I'd go with her to dialysis. I would go with her to her hospital stays when she was staying. I'd go with her to her doctor's appointments. And I was like, maybe I want to be a nurse. And then it was time for me to pick what I wanted to do. And I'm like, I don't know. So I just picked elementary ed. And I went for several semesters. And I was like, you know, I like it, but this is not exactly what I wanted to do. And then I happened to find upon this diploma nursing school. I went for an open house, and on a whim, I was like, I'm doing it. And I did it. And I am so glad that I did it. But I think that I got the best of both worlds, because as I was researching more into nursing and I realized all that nursing can be. I mean, it is not just you in a hospital forever, you know, ever and ever, amen. You can go back, you know, you can get your bachelor's, but you can work in a clinic, you can work in informatics, you can work in education, you can work at case management, you can work remotely. I know a lot of people that ended up going into like medical sales and doing things with that. You can stay in, and there's nothing wrong with staying in a hospital forever either. I've known plenty of nurses that worked from the day they graduated nursing school until they retired and worked in a hospital, work in a doctor's office. Like, there's just so many options. You could work with technology. You know, I'm in, like I said, a PhD program, and I have a gentleman in my class who does a lot with technology and working with like electronic medical records and other technologies to help with like telehealth and things like that. Like, there's just so many options. So again, long story going back, I decided to go back for my master's in nursing education. So I like to say I got the best of both worlds, because I always wanted to be a teacher and a nurse. And now I am a teacher and a nurse. A nurse teacher. Teacher nurse. Whatever.
That's really cool.
Yeah.
Did you enjoy the diploma nursing program? Do you think it best fit your needs?
I think that's, a loaded question. Nursing school is not something that I think that I ever personally want to go through ever again. It was grueling. It was difficult. So you're put to the test a lot physically and emotionally in being a nurse, because there is a lot to learn in a short amount of time. There's a lot of pressure. There's a lot of pressure to succeed. There's a lot of pressure to pass boards. There's a lot of pressure to get your first job. I feel like from not just from yourself, but from your professors too, because we also have standards that we have to uphold, and accreditation in a nursing program. So yeah, your professors want to see you succeed on a personal level, but we also want you so we can remain accredited.
Yeah.
So there's a lot of pressure on all people involved. And it was hard. But looking back, I would still choose to do the same route that I did. I would still choose to do a diploma program. That was how I best learned, was, like I said, being in a hospital, being in that setting. I could have my hands on mannequins and supplies. I could get my feet dirty in clinical, and I could just soak up all of the experiences and learning experiences, because I also think nursing school is what you make it.
Yeah.
I tell my students this all the time. I don't know what you don't know, but I also know how to be a nurse. So I need you to tell me how I can best help you to learn. I am not the gatekeeper of information. Yeah. I want you to learn, and I want you to get these experiences, but I don't know what you don't know. So we have to work together as a partnership, where I feel like, back then it was a lot more of a dictatorship. You are going to sit here and you are going to listen to what I say. You are going to take this exam. You are going to go to clinical, and you are going to do this, this, and this. Yeah. Now it's more, I try to make it more of a partnership.
Okay.
But again, everybody's experience is different. I wouldn't trade it though, because it's made me into the nurse that I am, but it's also helped me be the kind of educator I want my students to have, if that makes sense.
Yeah.
But I'm glad I went the route that I did, and I'm glad that I went and I got my bachelor's online, because I think that helped me be a better nurse, because I learned more about like the theories and the sciences behind what we do. Whereas in the diploma program, you're just there for like the nursing pieces. You don't get any of like the background, the foundation, the knowledge, the nursing science, the nursing theories. Yeah, you're just there to learn how to take care of your patients, pass your boards, and work.
Yeah.
So, but yeah, I mean, I'm glad that I went the route that I did, because I think I needed that. I was just ready to go.
Yeah.
So you had me at 22 months, instead of looking at 4 years, in the span of the time.
Yeah, definitely. So, if you could go back and give your college self a piece of advice, what would you say?
I am a perfectionist. I want to do things to what I think are the best of my abilities. I was a 4.0 student all the way up to nursing school. So I wish that somebody would have told me, or I could go back and tell myself, the test, a score that you get on a test is not reflective of the nurse that you are.
Okay.
I would get B's and C's in nursing school, and I would be absolutely devastated. But that doesn't mean that I am a 75% nurse, because I would get a 75% on a exam. You know what I mean? Yeah. I wish that somebody would have said, your test reflection or your test grade is not a reflection of the type of nurse that you are. The type of nurses that you are or will be is what you do when you go in that patient's room and you are holding somebody's hand as they are passing away, or you are holding somebody's hand during the worst day of their life and comforting them, and you know what to do in that emergency situation. You know how to be present, not just physically, but also emotionally and spiritually and physically for that person. That's the true test.
Yeah.
And I wish I would have known that, or I wish I could have told myself that.
Yeah. Do you think a lot of nursing students are like that?
Yes. I will have a lot come to me, and because they have, they were a 4.0 student before they got into the nursing program and taking their prereqs, and then they come in and they get maybe like a 90%, 85%, 80% on an exam, and they are devastated. And I try my best. I know, and it doesn't mean anything in the moment when you are stressed, and that how much work you put into that is not reflected in the score.
Yeah.
But I always tell them, I know it's hard to process now, but give yourself 5 minutes to be angry, to be frustrated, to be upset, and then move on, because it's what you make of it. It's what you put into it. It's what you do when you go in that patient's room. You are going to learn from it. And I will tell you, anytime I've ever made a mistake as a nurse, I've did that one time. Mm-hmm. I learned from it, and I was absolutely devastated, but I only let myself be devastated for a minute, and then I had to move on because I have other things I have to focus on. I have other worries that I need to address. Yeah. So, but it's not the reflection of the type of nurse that you are. You're human. We have to have our human emotions. You're feeling valid, but we need to move on because that is not a reflection of the type of nurse that you are. Yeah. One test grade is not going to
definitely
do that to you. I want you to pass my class. Mm-hmm. I want you to pass all your classes and be successful. I want you to pass your boards, but I also want you to know it's not the end of the world. Yeah. If you have a B average or a C average.
Yeah. Definitely. No patient asks what grade you got in nursing school.
That's the other thing. I've never had a patient ask me. I've never had a job ask me what my GPA was. The only time my GPA mattered is whenever I wanted to go back and further my degree. Yeah. That's the only time it mattered. Nobody's ever asked me where I went to nursing school. Yeah. Except for my first job. They were just, that way they could prepare me for my orientation. Yeah. Coming from a diploma school, I had a lot more clinical hours than somebody in an associate's or bachelor's program did. Yeah. So I had a little bit of a leg up there. My orientation wasn't as long as somebody who didn't have as much clinical time as me. Yeah. That's the only time it literally mattered. That is the only time.
Yeah, definitely. So what is one question or topic, kind of wrapping things up here, that you wish I would have asked or we could have talked about or anything like that?
I feel like the perception of nursing. Okay. I think, now, whenever I first started nursing, we didn't have social media and we didn't have, different portrayals of nursing that you can get your hands on now. Mm-hmm. I think based on the media, during COVID, we were healthcare heroes, and now it's back to, where we were. You can go into a Halloween store and you can see the sexy nurse costume. Yeah. Which I've never worn anything like that in my life. I wear scrubs to work, and I'm a little bit more prepared. Or you see the fight on maybe like the news where we're going on strike because we want better ratios. We want better patient safety, better pay for the things that we do and everything like that. And I think that can be a negative portrayal of nursing, and it's not an actual reflection of what we do. Same thing if you watch like a medical show. Yeah. Like if you're watching Grey's Anatomy, just the reflection or the drama that happens. Like we don't have time for hookups in the break room or in the supply closet. We don't have time for some of the drama that is displayed on there. Yeah. Not saying it doesn't happen. It can, but I just wish that, nursing is, what is it? The number one trusted profession. Yeah. I guess I just wish that people understood more the perception of behind what is nursing and what all we do in a day, and why it would make sense that when we get home, like we just want to sit in the shower and rinse everything away and maybe not talk for a little bit. Yeah. Maybe, just kind of decompress because we might have saw or did something emotionally traumatizing that day, or even just how much physically you give of yourself to other people. So at the end of the day, I usually have nothing left to give. But it's not a bad thing. It just means that I know that I loved and cared about somebody else that much that I don't have a lot left in me at the end of the day. So I don't want anybody to think, like, that listens to that thinks that I'm saying that in a negative manner. Yeah. It's just, I have a lot of love and I have a lot of care to give, and it makes me satisfied knowing that I could give that to somebody else. Yeah. That I would, that I would go home and somebody would know that I would take care of their grandma or their dad or their brother or their best friend the same way that they would. Yeah. So, but like I said, perception of nursing, I think, is something that I wish that people saw in a more positive way and not in a dramatized or sexualized way.
Yeah. No, that makes sense. So what's one tip that you can give to the audience about nursing or just life in general?
You're human, so it's okay to be human and have human emotions, reactions. They are totally valid. It is not a weakness. It is your strength. Use use that to find and build on your emotional intelligence so that you can improve on your relationships. No matter what profession you do, you're going to deal with people, so learn how to emotionally process and deal and be the best that you can be, not just for your coworkers or your family, but for yourself.
Yeah.
I think it's a really important thing. And I think especially if you're somebody who, like me, who wants to be in a people capacity where you care for other people, you need to learn how to emotionally process things. And it's not just a physical demand, but there's also that emotional side of it too that you need to process and deal with.
Yeah.
And it's okay.
For sure. So my last question might seem kind of funny, but the name of my podcast is called Samples of Science Cuisine. So what's your favorite type of cuisine or your favorite type of food?
I am very juvenile. I love pizza.
Yes.
Tacos. Those are probably my top 2 favorite. I actually, in that crumble cookie box you see behind me, there are 3 slices of Pizza House pizza inside of there and cookies because I love cheese and I love sweets.
Yes. That's not juvenile because sometimes you just need sweets.
You do.
And sometimes you just want pizza.
You do. And I think my students at the start of the semester always giggle out of it, but you can see behind me, I've used it so much that it's broken. I call it my emotional support box. And it is just literally a bag full of candy. I have Nerds, I have Twizzlers, I have chocolate, I have, there's gummy bears in there, and I just take that to every class with me because that's how I guess, decompress is I get a little sweet treat.
Yeah.
I validate that.
Yeah.
So I brought myself today my little sweet treat.
Yeah. Well, thank you for talking with me today. This was very educational.
Thank you for having me.